My name is Monifa Thomas-Nguyen, and I'm with the Cook County Health and Hospital System. And today we have a great guest. We have Dr. Jorelle Alexander, and Dr. Alexander is the chair of Department of Oral Health here at the Cook County Health and Hospital System. So thank you so much for being on the show tonight.
Well, thank you for having me. I'm glad to be here.
Sure. And so just so we all know, kind of what we're talking about, can you just sort of explain what exactly is oral health and, how does it work?
Okay. So when we're talking about oral health, we're talking about the teeth, the gums, and all of the craniofacial structures that are important to, from the neck up, basically. Mm-hmm. So everything that has the entryway to your body.
Okay. And so can you talk about what are some of the common things that the dentists treat?
Okay, so when we talk about what dentists treat, of course, cavities. They treat masticatory disorders, and that's related to people's ability to chew, sometimes ability to speak and function. We also treat cosmetic things, so patients who are looking to have whiter teeth, or maybe have malalignment and are needing of orthodontia. We also treat infections, as well as other dental diseases that have an overall effect on the regular body.
Okay. And how long have you been a dentist?
I've been practicing for 11 years.
Oh, wow. Okay. Mm-hmm. And how did you decide to, get into this field?
So I've always wanted to help other people, and always had a love for medicine. And believe it or not, my grandfather was a dentist.
Oh, okay.
So I had a little bit of exposure as a child, and working for the American Academy of Pediatrics actually gave me the rest of the exposure.
Sure. Okay. Yeah. And then, so correct me if I'm wrong, but it seems like a lot of people kind of know about oral health in connection to cosmetic things. So, they want to get this better smile or whatever, and then so they just want to see a dentist for that. But can you talk about a little bit more about, what exactly is is oral health? So why is it so critical for adults and children?
Okay, so your mouth is actually the entryway to your body, and it's very important, and people just don't know because they haven't been exposed and nobody's taken the time to educate them. But when we talk about oral health, we're talking about the entryway to the health of the rest of your body. And so we're talking about its impact on other organs like your heart, your liver, your lungs, your respiratory system, and even reproductive system.
Okay. And can you talk a little bit more about, those illnesses that, say, if your oral health is not great, it might be an indication of some of the other parts in your other body where, this might be an indication that there's something wrong in those areas.
Okay. So absolutely. One of the things is that the oral cavity can also manifest different types of diseases. So diabetes, your oral health can have an impact on your systemic health as it relates to cardiovascular disease, also as it relates to rheumatoid arthritis, stroke, and for our pregnant moms, it can have an effect on their unborn babies.
Can you explain that one a little bit further, the pregnant women and the children?
Absolutely. So there is a lot of research that has been done that shows a direct correlation between one's oral health for a pregnant woman and low birth weight and preterm labor.
Oh, that's interesting. Okay. And then what are some warning signs that you might not have a good oral health?
Okay, so some of the warning signs are, of course, bad breath, bleeding gums, pain, pus, swelling, holes, dark spots. All of those are some telltale signs that your oral health or your oral cavity needs to be checked.
Okay. And then so if you find those signs, what are some things that you should do?
First and foremost, go see a dentist.
Okay. And how often should someone see a dentist if they're an adult?
If they're an adult, they should be seeing a dentist at least every 6 months. And that's pretty much if they're healthy. If their oral health, their oral tissues, the teeth and gums are healthy and they're taking care of them, 6 months is the minimum.
Okay.
Some patients will need to come see us more frequently than that, but at bare minimum every 6 months.
Okay. And then what about with children?
Children, the same thing.
Okay, got it. And so, most kids are going to be heading back to school in September. Sorry about that, kids.
Yes.
But I'm just wondering, would you agree that parents should, making sure their kids' teeth are checked? Should that be included as part of the back to school health, exams and everything before they go to school?
Absolutely. So when we talk about preparing children to go back to school, we're talking about preparing them as a whole. And so your mouth, your oral cavity is connected to the rest of the body. And so that should be examined as well to head off any kind of disease that may have an impact on that child.
Got it. Okay. And then the CDC has noted that 90% of American adults have had a cavity in their lifetime. And so can you just sort of explain what cavities and or tooth decay are and sort of why they're especially bad for kids?
Oh, absolutely. So when we're talking about tooth decay is actually a byproduct of the bacteria in your mouth, and once it has fed off of sugary substances, it produces a byproduct that is lactic acid, and that acid eats away at the outer surface of the tooth, causing the cavity, the cavitation. And so that's what tooth decay is.
Okay. And then what are some signs that would sort of indicate that someone might have a cavity?
Bad breath is a sign that there may be a cavity. Any kind of holes that you may see, any kind of dark spots, pain, of course, is a sign, and sensitivity as well.
Okay. And then are there cavities more common for some children? And if so, can you sort of explain who those kids are?
Yeah. So cavities are very common amongst children who lack access to health care. And so when we're talking about kids that don't get to see a dentist on a regular basis, those children who engage in behaviors such as eating lots of junk and drinking lots of sugary substances are more prone to developing cavities.
Okay. And it looks like we have a caller.
Okay,
Go
great.
ahead.
Hi, doctor. I was just wondering if you really need to be flossing your teeth, because I read online on Wikipedia that it's not really important as long as you brush them.
Okay, so brushing is one component of keeping good oral health, but flossing is a second component. And so flossing gets into areas that an actual toothbrush cannot reach. So flossing is very, very important. Being able to go in between the teeth and to remove the bacteria that's there that a toothbrush cannot reach.
And do you
What happens if the floss gets stuck in my teeth?
Okay, so one of the things that you want to make sure is that you're using the correct type of floss for you, and that you're using the floss in the correct motion. So when you're using the string floss, you want to make sure that you're pulling that string down and not trying to pull it back up, which is where a lot of patients sometimes get that string getting caught in their tooth. But when you pull that down, you want to pull it out.
Great. Thank you so much.
You're welcome.
And then, as far as flossing is concerned, how often should you do that? Should it be twice a day as well, or?
You want to be able to floss at minimum once a day, but if you make it a part of your oral health regimen, and at the time where you're brushing, you remember to floss, you're even in a better position.
Okay. And then also, just in regards to, there are so many different types of floss. Like, and I was just wondering, is there like good ones that are better to use than others?
No, it's really about preference.
Okay. Yeah. And then while we're on the subject, what about like your toothbrush? I know there's like electric brushes, there are regular brushes, but then they have hard things.
Bristles?
Bristles, thank you. Like, does it matter which one you use?
It does, and so what we recommend are soft bristle brushes.
Okay.
And we recommend soft bristle brushes because if you're using a harder bristle, you could actually do damage depending upon how much pressure you're using when you're brushing your teeth. Electric brushes are wonderful as well because they tend to move in a manner that allows them to remove more plaque than you can do manually. And also, it has much benefit for those patients who have manual dexterity issues, meaning that they can't really hold a toothbrush well or move a toothbrush well. So our handicapped patients, our children, our elderly, they benefit greatly from electric toothbrushes.
Okay. Would it benefit at all to like maybe mix them up? Like use both?
There's really no benefit. I think if you find a good toothbrush, you should just stick with it.
Okay. And then what about toothpaste, just in terms of, because you have so many different types, and you have tartar protection, and then teeth whitening, and then all those other things. I'm just wondering, does it matter with that as far as toothpaste?
So when we're talking about the toothpaste, again, that's a preference issue as well. What we want to remember is that we want to use fluoridated toothpaste, okay? And so when you start going beyond that and looking at whether it provides protection for gum disease, or whether it addresses bleeding gums, or it addresses tooth whitening or tartar protection, all of those things are really conversations that you should have with your individual dentist so that that treatment plan is individualized for you. So it should never be someone like me giving a broad statement about using a specific toothpaste that really may not be meant for your condition.
Okay, that makes a lot of sense. And then going back to tooth decay and cavities, I'm just wondering, what are there any things that parents can do to sort of minimize their kids getting tooth decay?
Yeah, minimizing tooth decay, the first thing is good oral care. So we want to make sure that our parents are brushing and flossing our children's teeth, and we need to be making sure that our parents are helping our young kids, because our kids don't have the hand skills to be able to do that until between the ages of 7 and 9. And so if we think about our children having teeth before age 1, parents, we've got 9 years where we need to be helping our children brush and floss.
Sure.
In addition to the good oral care, we also need to be monitoring their intake. And so we want to monitor how much sugary substances we allow our children to have, and how much snacking we allow them to have as well.
Okay, so on that topic, like what about Halloween? So if you just have one bad, or I guess that's like a couple weeks maybe, of sweets and everything, is that okay, or should really you just like give the candy to someone else?
So, you know, I come probably from a different school than some of my other colleagues. Children can have sugary substances, but it's all about moderation, and it's all about accompanying that with good oral hygiene at home. So if they're having and partaking in things that are candy or fruit snacks, we want to make sure that we're having our kids brush their teeth after they've taken those substances, so that that bacteria doesn't get to feed off of the sugar.
Okay. And then going back, can you tell me again, what age should children start brushing their teeth?
So we want to make sure that children develop good oral hygiene habits from the very beginning. So even before they get their first tooth, parents should be wiping out the insides of their children's mouths to ensure that the milk is not staying there on the tongue or any of the oral surfaces. And so once children get used to that, we can start to introduce a toothbrush by age 1, actually by the time they have their first tooth.
Okay. And then as far as the dental sealants, do you recommend those for children as well?
Absolutely. Dental sealants are protective. It's a preventative service. It helps us to ensure that children keep those molar teeth healthy and without cavities. And so those kids who are exposed to a lot of sugar or have deep grooves in those teeth, absolutely we want to make sure we seal those crevices up to avoid the cavities.
Okay. And are there any other tips that people can sort of kind of keep their teeth healthy, as far as like for parents should know for their kids?
Make sure that you're taking your child to see a dentist. Avoid sugary drinks. Promote the intake of water and good oral hygiene.
Okay. And then for adults, is there anything that adults can do to possibly keep their teeth clean?
Absolutely. So same things with the kids. You know, the nutrition is key, good oral hygiene is key, but for adults we also want to make sure that we are avoiding tobacco and tobacco products, and we want to limit the alcohol consumption as well.
Okay. Can you explain a little bit more about why those two are important, about limiting those?
Absolutely. So when we talk about the tobacco has not only an effect on the gum disease, the periodontal disease, but also is a risk factor for oral cancers.
Oh, I did not know that. Okay.
Absolutely.
And so for people that are drinking alcohol, is there a limit as far as like how much they can have without causing some of these issues that you're talking about?
You know, there's not a hard, fast research that says 2 drinks is all you can have, but we do counsel our patients and say no excessive intake.
Okay, got it. And then as far as the dental health, obviously, is not always included in health insurance, unfortunately. So I'm just wondering, for people that they want to take care of their teeth, but they may not have the money to do so. Are there avenues where people can, get help?
Oh, absolutely. So particularly at Cook County Health and Hospital Systems, we currently have 4 ambulatory clinics that offer a full spectrum of dental services that is geared to patients who are either underinsured or uninsured. So patients who don't have the means have the ability to come and get full dental care. At Cook County, we are also have a number of dental clinics opening by the end of this year. So there will be more opportunities for patients who are in need to come see us.
And where will those clinics be located?
So one of the clinics will be located right on the Stroger Hospital campus that will be opening up in October of this year. And our second clinic opening up by the end of this year will be located in Arlington Heights.
That's very exciting.
It's very exciting.
Okay. And then as far as, and I'm also just going to give you guys the, for anybody who's looking to get in touch with the Cook County Health and Hospital System, I'm just going to give you the information for that. So if you need health care, you can go to 312-864-0200. Again, that number is 312-864-0200. Now, as far as the other tips for people to, kind of keep their teeth clean. Any others that we maybe didn't cover, or you want to just kind of highlight, just because?
So one of the things I wanted to really stress is the importance for parents to take care of their children's teeth. Having dental disease as a child has long-lasting impacts on their development, their ability to learn, and also can affect their ability to eat, speak. And so parents typically think that, oh, they're just baby teeth and they'll lose them, we don't have to take care of them. But not taking care of those baby teeth have long-lasting implications for the adult teeth that are to come behind and for a child's overall development.
And can you explain a little bit more about why you say there's an impact on the, as far as their learning ability?
Absolutely. So there has been lots of research that shows that there are more missed days of school for dental disease in comparison to some other childhood chronic diseases like asthma. So more children miss school for dental disease than they do for asthma.
Oh, okay. That's very interesting. And as far as, excuse me, give me one second. Apologize. And then as far as kids needing healthcare, are there, because not every kid loves being in a dentist's place. So I'm just wondering, any tips for, say if you have you're a parent who has those kids, any tips to sort of get them willing to go, other than sort of forcing them to go?
Getting the children started early.
Okay.
So getting those exams done early, wiping the mouths out when they're infants, brushing the teeth when the first teeth come. All of those things get children familiar with the dentist and dental activities. So then it's not, such a scary experience for them. A lot of times too, parents are scared, and so they project their fears onto their children.
That is very true, because yes. Okay. And anything that I haven't asked you that you just want to cover?
No, I just think that at this time it is very important for both children and adults to be seen, to be examined, to have their oral health checked, and to follow up with the dentist.
Okay. And then just in case anybody missed it, can you just give them the list of where they can go as far as the Cook County Health and Hospital System for help?
Absolutely. So we have 4 ambulatory clinics. There's a clinic located in Fort Heights, Illinois at 1645 Cottage Grove. There's a clinic located in Robbins, Illinois, located at 13450 South Kedzie Avenue. There's a clinic located here in Chicago on Pulaski, and that's Prieto Health Center at 2424 South Pulaski. We have a clinic located at the Rolling Meadows Courthouse in Rolling Meadows. It is at 2020 Euclid Avenue, and we're located on the 2nd floor of the Rolling Meadows Courthouse. And then we have one more clinic located here, and that's at the Ruth Rothstein Core Center, located at 2020 West Harrison.
Okay. Thank you very much.
You're welcome.
Yeah. So, we just want to definitely encourage people to get, their oral health checked. And can you just sort of restate, what you were saying about why that's so important, what the link is between oral health and
Yes.
Just because I feel like that's very important.
Yes. The oral health, the mouth is the entryway to the rest of the body. The oral health has implications for other systemic diseases such as diabetes, cardiovascular disease, stroke, rheumatoid arthritis, and has an impact on the unborn child for our pregnant patients.
Got it. Okay. And it looks like we have a caller. Caller,
Okay.
go ahead.
Hi, yes, Dr. Alexander. I have a question for you. My teeth are kind of all over the map. What can does Cook County offer orthodontics, or what else? What options do I have to get my teeth either pulled out or straightened, or to make sure that it doesn't cause migraines and other things?
Okay. So at this time, Cook County Health and Hospital Systems does not offer orthodontia or orthodontic services. And so there are some low-cost options available to patients that are a little bit more feasible than some other options, particularly some of the dental schools are options for some of the advanced services at a low cost.
Okay, thank you.
You're welcome.
Well, thank you so much for joining us tonight. I really appreciate it.
Well, thank you
And
for having us.
Thank you very much for joining us, watching the show. Take care.
Thank you.